One of your biggest expenses is probably your health insurance. On top of that, with high copays and deductibles, you're probably paying even more than ever for health care.
In our KOTA News Extra, Smart Medicine, Helene Duhamel looks at some of the factors you need to consider to make smart health decisions. But we need to warn you, some of the images you're about to see are graphic.
About 9 months ago, I noticed this lump on my foot. I asked my doctor to remove it and was told to get an MRI since it appeared to be attached to the bones. It was, as suspected, a non-complicated ganglion cyst that did not involve the joint space, about the size of a walnut between the toes. Since the orthopod would not do the procedure in his office, it was drained, but it returned. I already had thousands into this annoying cyst. It appeared my only option was to go to a surgical center to have it removed. That meant I prepare like any other major surgery. Blood work, a physical, fasting, anesthesia, a driver, and no guaranteed time slot. I thought that was overkill for a cyst. Way too time-consuming and expensive. So I looked for a better, more affordable option. I turned to Greg Wittenberg.
No, I think what we can do is make a small incision over the surface and then just gently work underneath the cyst.
A fellowship-trained dermatologist who regularly removes skin cancers and cysts in his office. Instead of anesthesia, which I did not want, shots numb the area around the cyst. Wittenberg says dermatologists are uniquely suited to this kind of thing.
In my practice and what I do, it works very well for me to do this sort of a procedure, a cystic type of procedure, in an outpatient setting. A lot of it is I'm lucky to have nurses who day in and day out, this is what we do. And we have a certain routine, to prevent postoperative infections, postoperative bleeding, good outcomes, complete removal of the cyst in this instance, or tumor, if you will.
It did not come out in one piece. Since it was attached to the foot bones, it was scraped out in pieces, then cauterized.
Okay.
So hopefully this cyst doesn't grow back again.
In my hands, my practice, this works best to have it removed in this sort of a setting.
In a half hour, it was all over, just stitching it up. An office surgery like this is a savings of thousands of dollars, a lot of time and hassle.
The climate, if you will, of medicine today and the education level, if you will, of the patient today, the two have to meet. There are arguments for and against surgical centers for more minor procedures. And to be the devil's advocate of surgical centers, the surgeons, if you will, have argued for surgical centers because it provides a certain standard. You have to go through certain guidelines and accreditation to actually perform surgeries at these centers, whereas when you're in an outpatient basis, you don't necessarily have to have that.
No matter the setting, make sure your surgeon is qualified and experienced with your particular issue. Helene Duhamel, KOTA Territory News.
A few things to consider when making your healthcare choices. Be educated, ask questions, and look at options. Tomorrow on our KOTA Health Extra, Smart Medicine, Helene looks at how the patient needs to be his or her own advocate.